Mumps. Mumps is an illness caused by a virus. It usually happens in childhood. Mumps are easily spread by airborne droplets from the upper respiratory tract. The disease usually takes 2 to 3 weeks to appear. Mumps is a contagious viral infection that used to be common in children before the introduction of the MMR vaccine. The mumps virus is present throughout the world and hence, risk of exposure to mumps may be high. In many countries worldwide, mumps remains endemic. The mumps vaccine is in use in only 57% of countries belonging to the World Health Organization, WHO, predominantly those countries with more developed economies. Worldwide variations in the number of persons who receive the mumps vaccination make it difficult to estimate the number of cases. The incidence varies markedly from region to region. Mumps is an acute, self-limited, systemic viral illness characterized by the swelling of one or more of the salivary glands, typically the parotid glands. The illness is caused by the RNA virus, rubeolavirus. Rubeolavirus can be isolated in viral culture from saliva, urine, and cerebrospinal fluid, CSF. Chemical agents, ether, formalin, chloroform, heat and ultraviolet light can inactivate this virus. Mumps occurs worldwide. Humans are the only known natural hosts. This paramyxovirus is highly infectious to non-immune individuals and is the only cause of epidemic parotitis. Although mumps cases occur at any time of year, an increase in case number is noted during late winter and early spring. How mumps is spread? Mumps is spread in the same way as colds and flu. It spreads through infected droplets of saliva that can be inhaled or picked up from surfaces and transferred into the mouth or nose. A person is most contagious a few days before the symptoms develop and for a few days afterwards. During this time, it's important to prevent the infection spreading to others, particularly teenagers and young adults who have not been vaccinated. If you have mumps, you can help prevent it spreading by 1. Regularly washing your hands with soap. 2. Using and disposing of tissues when you sneeze. 3. Avoiding school or work for at least 5 days after your symptoms first develop. Transmission and course of the virus. Humans are the sole reservoir for the mumps virus. The transmission mode is person to person via respiratory droplets and saliva, direct contact, or fomites. Antibodies. The presence of maternal antibodies typically protects infants younger than 12 months old from the disease. Infections can be asymptomatic in 20 to 30% of persons. Of those with symptomatic infection, adults tend to be more severely affected when compared to children. Lifelong immunity usually follows clinical or subclinical mumps infection, although second infections have been documented. Mumps has an incubation period of 16 to 18 days, however, cases can arise 12 to 25 days after exposure. After this period, prodromal symptoms, such as low-grade fever, malaise, myalgias, headache, and anorexia, occur. These symptoms can last 3 to 5 days. After this prodromal period, about 48 hours, the clinical path of the virus depends on which organ is affected. The most common presentation is a parotitis, which occurs in 30 to 40% of all patients and in 95% of those who are symptomatic. Parotitis is caused by direct viral infection of the ductal epithelium and presence with localized gland inflammation. Other reported sites of infection are the central nervous system, CNS, eyes, pancreas, kidneys, testes, ovaries, and joints. Mumps is the only known cause of epidemic parotitis. As such, parotitis is used as a clinical parameter of maximum communicability of the mump virus. A patient is considered infectious from about 3 days before the onset of, and up to 4 days after, the start of active parotitis. Although it has been suggested that the communicable period is actually longer, lasting from 6 days before, to 9 days after, facial swelling is apparent. Who's affected by mumps? Most cases of mumps occur in younger adults who did not receive the MMR vaccine as part of their childhood vaccination schedule and did not have mumps as a child. Older adults who were born in the UK before the vaccine was introduced are likely to have had mumps as a child. Once you have been infected by the mumps virus, you normally develop a lifelong immunity to further infection. The MMR vaccine was introduced in 1988. Adults born between 1980 and 1990 may not have been vaccinated as children, and are less likely than older adults to have had mumps as a child. Mumps is currently most common among people born in the late 1990s and early 2000s who missed out on the MMR vaccine as children. Symptoms of mumps. Some people infected with the mumps virus have either no signs or symptoms or very mild ones. When signs and symptoms do develop, they usually appear about 2 to 3 weeks after exposure to the virus. The primary sign of mumps is swollen salivary glands that cause the cheeks to puff out. Other signs and symptoms may include pain in the swollen salivary glands on one or both sides of your face, pain while chewing or swallowing, fever, headache, muscle aches, weakness and fatigue, loss of appetite. Causes of mumps. Mumps is caused by a virus that spreads easily from person to person through infected saliva. If you're not immune, you can contract mumps by breathing in saliva droplets from an infected person who has just sneezed or coughed. You can also contract mumps from sharing utensils or cups with someone who has mumps. Complications of mumps. Complications of mumps are rare, but some are potentially serious. Most mumps complications involve inflammation and swelling in some part of the body, such as testicles. This condition, known as orchitis, causes one or both testicles to swell in males who've reached puberty. Orchitis is painful, but it rarely leads to the inability to father a child, sterility. Brain. Viral infections such as mumps can lead to inflammation of the brain, encephalitis. Encephalitis can cause neurological problems and become life-threatening. Membranes and fluid around the brain and spinal cord. This condition, known as meningitis, can occur if the mumps virus spreads through your bloodstream to infect your central nervous system. Pancreas. The signs and symptoms of this condition, known as pancreatitis, include pain in the upper abdomen, nausea and vomiting. Other complications of mumps include hearing loss. Hearing loss can occur in one or both ears. Although rare, the hearing loss is sometimes permanent. Heart problems. Rarely, mumps has been associated with abnormal heartbeat and diseases of the heart muscle. Miscarriage. Contracting mumps while you're pregnant, especially early in your pregnancy, may lead to miscarriage. A list of potential complications from mumps infection is cited below. Aseptic meningitis or encephalitis, sensorineural hearing loss or deafness, transverse myelitis, inflammation of both sides of one section of the spinal cord. Polyneuritis, Guillain-Barré syndrome, cerebellar ataxia, sudden, uncoordinated muscle movement due to disease or injury to the cerebellum, with encephalitis. Keratovitis, active corneal disease associated with anterior chamber inflammation, thyroiditis, myocarditis, mastitis. Pneumonia, pancreatitis, nephritis, kidney tissues inflamed, orchitis, and inflammation of one or both testicles. Oophorytis, inflammation of an ovary, arthritis, thrombocytopenia purpura, platelets destroyed by the immune system. Diagnosis of mumps. If you or your child has signs or symptoms of mumps, the doctor is likely to ask whether you or your child has been vaccinated against mumps and whether you might have been exposed to the virus. Recommend a blood test to check for evidence of the mumps virus. Physical examination. Parotid glands are not palpable in the craniofacial exam of a healthy patient. But for patients with mumps, the parotid glands rapidly progress to maximum swelling over several days. Patients may have trismus. Submandibular glands may also be involved in swollen. Approach considerations. Mumps is a clinical diagnosis. A study investigated the difficulty of medical professionals to diagnose mumps, noting that only 14% of 2082 cases occurring during an outbreak could be confirmed by laboratory serotesting. This study concluded that the examiner's ability to diagnose mumps as based solely on clinical presentation was low. Treatment of mumps. Mumps is caused by a virus, so antibiotics aren't effective. But most children and adults recover from an uncomplicated case of mumps within a few weeks. People with mumps are generally no longer contagious and can safely return to work or school about 5 days after the appearance of signs and symptoms. Lifestyle and home remedies. Rest is the best treatment. There's little your doctor can do to speed recovery. But you can take some steps to ease pain and discomfort and keep others from becoming infected. Try to isolate yourself or your child to prevent spreading the disease to others. Someone with mumps may be contagious up to 5 days after the onset of signs and symptoms. Take over-the-counter pain relievers such as acetaminophen or non-steroidal anti-inflammatory drugs such as ibuprofen to ease symptoms. Use a warm or cold compress to ease the pain of swollen glands. Wear an athletic supporter and use cold compresses to ease the pain of tender testicles. Avoid foods that require lots of chewing. Try broth-based soups or soft foods, such as mashed potatoes or oatmeal. Avoid sour foods, such as citrus fruits or juices, which stimulate saliva production. Drink plenty of fluids. If your child has mumps, watch for complications. Call your doctor if your child develops fever of 103F, 39C, or greater, trouble eating or drinking, confusion or disorientation, abdominal pain. In boys, pain and swelling of the testicles. Protect your child with mumps vaccine. Mumps vaccine is the best way to decrease your child's risk of getting mumps. It is usually given as part of a combination vaccine that protects against 3 diseases, measles, mumps, and rubella, MMR. Children should get 2 doses of MMR vaccine. The first dose at 12 through 15 months of age, and the second dose at 4 through 6 years of age. The MMR vaccine is safe and effective. Most children don't have any side effects from the vaccine. The side effects that do occur are usually very mild, such as a fever or rash. Your child's doctor may also offer the MMRV vaccine, a combination vaccine that protects against 4 diseases, measles, mumps, rubella, and varicella, chickenpox. This vaccine is only licensed for use in children who are 12 months through 12 years of age. Protect yourself against mumps. Anyone born during or after 1957 who has never had mumps or has never been vaccinated is at risk for mumps. They should get at least 2 doses of the MMR vaccine. Teens and adults should also be up to date on MMR vaccinations. A person with 2 doses of MMR vaccine has about an 88% reduction in risk for mumps. A person with 1 dose has a 78% reduction in risk for mumps.